Sorry for the technical delay. Today we have Professor Dada Kokare as our guest speaker for today's morning session. He did his graduation from Baramati, M.Pharm from Karad, and PhD from Nagpur University in pharmacology. His area of interest are neuroscience related work with special emphasis on behavioral pharmacology using rodent behavioral paradigms, immunohistochemistry, microdialysis, HPLC, ECD, molecular and epigenetic techniques. He has a total teaching experience of 19 years. He was a postdoctoral fellow at Department of Psychiatry, UIC, Chicago. He has successfully guided 7 PhD students, 48 M.Pharm students. Right now, 3 PhD students are working under him and 3 M.Pharm students are working under him. He has so far completed 8 major research projects and to his credit, more than 75 publications are there. He is a winner of Best Scientist Award of Rashtrasanta Tukdoji Maharaj Nagpur University, which was conferred on him in the year 2017. He is awardee of UGC Raman Postdoctoral Fellowship. As a resource person, he has delivered more than 35 talks and he is member of several academic bodies. So I have a great pleasure to welcome Professor Dada Kokare, and I hand over the proceedings to him for deliver his talk.
Yeah, thank you, Dom. Am I audible, Preeti ma'am?
Yes, sir.
Yes, sir.
Yeah. Without wasting much time in the introductory one, I want to just take you directly there to explain you the stereotaxic neurosurgery. See, this is the surgery performed for the neuroscience related work, in which I have been explained like exploration of the brain. Through this technique, we are really exploring the brain, rodent brain. So whether it is a rat or mouse, having the right atlases or the prerequisite that are being required in order to perform this surgery, we can really explore the each and every corner of the brain, and we can understand the total neuroscientific related work regarding the using this rodent as an animal model. So yeah, see, in front of you, this is the human brain. And if you understand grossly, I'm just telling you, the rostral part, there is a caudal part, and there are different lobes. Brain is divided like frontal, parietal, occipital, temporal one. Then there is the, we have this small brain, it is called the cerebellum. And then this is a pons area, medulla oblongata, and it extends to the spinal cord. This is the arrangement, that is how the different body organs are being controlled by the cortex area of our brain. Cortex, see, the brain is totally divided into the cortical part and one is a core part. Cortical part is a gray matter, whereas the core region is called the white matter. Gray matter is nothing but the neuronal cell, aggregation of neuronal cell, and white matter is only the axonal circuitry and complexation of it. So all the decision making capacity is being lies with the neurons, that is the bunch of neurons that lies into the gray matter. And here,
hello sir, hello, hello sir,
hello,
hello sir, hello sir, sir, please
hello,
make your slide on full screen, sir.
Okay.
If possible.
Yeah. So this is the upside down arrangement of the body organs over the cortex, in which you will find this is the lower limb, this is trunk area, and this is the forearm, and this is the head, tongue, and all these regions. So hereby this indicate that this much area of the cortex is being dedicated. These many number of neurons are dedicated in order to control, regulate the activity of these organs, and thereby you will find it is fully disproportionate, and only some part of our body has been given more attention compared to the other regions, wherein the areas anatomically which are greater in size, having very less number of neurons to concentrate over on it, and otherwise you will find in the different areas wherein the part of the body like the hands, you will find the lips, the tongues, eyes, ear, these are the smallest anatomical organs but has given the more concentration or has given the more number of neurons to attend them or to monitor their functions, and therefore this is called the cortex man. This picture is very unique. It rightly identify and giving the information that how many neurons of the cortex are being diverted or being aligned to that particular organ. So this is also called the homunculus man. Now the core part of our presentation, that is the stereotaxic surgery. Stereotaxic surgery, at name indicates, it is a three-dimensional movement. There are the coordinates, and by using the coordinates we can really navigate point to point in a brain of the rodent. The aim of this technique in neuropharmacology is to understand the effect or to know the mechanism of action of any drug that we are administering to the animal. It can be administered by any peripheral route of administration, but ultimately drug will reach into the brain, and then in brain at some nuclei it will produce the effect, and that nuclei, that neuroanatomical correlate, neuroanatomical functional correlate, that we need to understand, and for that stereotaxic is a best technique, wherein we have the art and science that has been combined together in order to reach a very specific point in the central nervous system by using the atlases that are available, through which we can really know the different coordinates, and then by using that coordinates we can have a very safe navigation throughout the brain by producing very minimum stress to the animal during the surgery. This slide depicts the first work that has been conducted on the stereotaxic apparatus, and that was on the cerebellum part. So it was not on the cerebrum area, it was in the cerebellum, that is a small brain, in which they understand the structure and function, and for which the method that is being employed, this is a stereotaxic technique, and this very much pioneer work is being done by Sir Victor Horsley and Robert Clark, and then they prepare the manuscript based on this stereotaxic surgery, and first time it has been published in International Journal Brain in 1908, and then further it has come into the Journal of Neuroscience Methods, and through which we understood the again different aspects of this technique, stereotaxic technique. One which is important part that is been required in order to perform this surgery is the atlas, and these rat atlases are available online also, or we can directly procure from the publisher. So see the cover page of the rat brain in stereotaxic coordinate atlas, in which you will find the sections are being taken by different orientation, like coronal sections, we are also called the transverse sections, sagittal sections, horizontal sections, and even the sections have been stained, and through which we can really see that which area is the brain nuclei and which is only the axonal area. And this is right from the olfactory bulb to the telencephalon, and we are going to the hindbrain and up to the spinal cord. This is for the mouse brain, again the cover page for the stereotaxic atlas, and this is by the Paxinas and Franklin. Here also you will find the different orientations in order to have the pictures of the brain, that is the sagittal, coronal and horizontal. This is the skull of rat brain. Just understand the rat skull, and in that rodent skull, this is the top view. In top view you will find that, see, this is the bony skeleton, and in that bony skeleton These are the frontal bones. These are the parietal one. Here are the temporal, and yes, here is a occipital one. So this one particular area that is been indicated on, or which is anatomically there, is an anatomical landmark that is available on the skull of animal, is called the bregma. Bregma is a point. If you fix animal into the stereotaxic frame, that pictures will come later, and then if you uh, make a lesion over the skin and open the skull area, you will find that there are lesion over the lesion over the skin and open the skull area, you will find, but the area through which so these two frontal bones are stitched together by the parietal bones, and these are called the coronal sutures. This is the posterior sutures. This is
Sir,
the
I think your
anterior one.
voice is breaking.
Sutures at the caudal side are called the lambadal sutures. Hello,
Sir, I think your voice is breaking,
am I
sir.
audible?
Sir, your voice is
रुक
not
रुक के
clear. It's
रुक
breaking.
रुक के आ रहा है सर ये
It's breaking, sir.
Okay, okay, sir.
Sir, also, if possible,
Sir,
please try to make it slideshow. We cannot see
Hello.
minute details and other diagrams on your slide. Please make it
sir,
slideshow.
slideshow
Sir,
Yeah.
शुरू करना
first
है,
make
sir.
the slide
Yes, yes.
enable.
It's
Sir,
okay, sir.
first
Right
make
now.
the slide enable. Then it is
Yes,
Yes,
yes.
it's,
possible
Now,
it's
only.
now,
okay,
voice
sir.
is
It's
clear.
okay.
Hello.
Yes, sir. Yes, sir. Both are clear. Please, sir.
Okay,
Continue.
right. So this is the top view in which you can see the very minute features of
Slideshow
the
mode,
rodent
sir.
skull, and in
Right,
that
sir.
you will find this is the bregma point and the lambda point. Bregma point, this one bregma, wherein two coronal sutures and one posterior and anterior sutures, they meet together. The meeting point of these four suture is called the bregma, which is present at the rostral side of the skull, whereas at the caudal side we are having the lambda point, which is not an anatomical position, but yes, investigator has to make assumption regarding the lambda, for which he has to make an intersect for the two lambadal sutures with the posterior suture, and the intersect point becomes the lambda. If we have to perform this surgery for caudal part of the brain, then we use lambda as a landmark, whereas for anterior or the rostral side, then we are using bregma as a reference point. The same thing in schematic one has been explained here, and yes, also we can find very clearly in the schematic that this is the bregma point and this is the lambda. For lambda we have to always make the intersect with the two lambadal sutures along with the posterior sutures, and that intersect point becomes the lambda reference point. This is the side view of the rodent skull, in which you will find the two positions. Bregma is here, lambda is here. This is the another reference point. This is called the interoral line, which is present laterally. And then to access the lateral side of the skull, it is a really difficult one. So usually people prefers the lambda and bregma as a reference point. And this is the upper jaw, in which brain reside here in this position, and in upper jaw you will find this is the teeth. It is called the incisor bar. In the incision bar we have to fix the stereotaxic frame such that it will become the unmovable or the immovable. See what picture we have seen here. This is the side view of the skull, and in that side view this is what is being accommodated. This is the brain, rat brain or the rodent brain, and see the position of bregma is here. So what we have seen from the outside means that is on the skull bony skeleton, that the bregma point, that really correspond to this part of the brain. Similarly, lambda what we have seen on the skull, which is correspond to this level, means like at the beginning of cerebellum we are having the lambda, and bregma is like at just anterior to the anterior commissure. And see, this is the olfactory bulb, this is the total telencephalon area, this is the cortical part, this is the hypothalamic region, this is the optic chiasma, it's a pituitary gland, and then these are the hindbrain regions, and of course this is a cerebellum. And you will find the scale is also been given on this slide. This slide is nothing but the one plate from the stereotaxic atlas of the rodent brain. See, this is the stereotaxic apparatus. Stereotaxic apparatus, you will find it is like very simple apparatus, and really it is that simple. In order to, only there are three coordinates. Just look at the apparatus, only three coordinates. This is called the anterior posterior coordinate, this is the lateral right and left coordinate, and this is the dorso ventral coordinate. So just see, by having these three coordinates, we can really navigate three-dimensionally any part of the brain, and we can reach, access that area for any reason in order to have a cannulation, implantation of electrode, obtain the diacylate, or the having the aspiration, or any type of manipulation is possible by using only these three axes which are present and having the availability over the stereotaxic apparatus. And here is a position wherein we can fix the skull of the animal. Now this is the actual picture of apparatus in schematically shown here, in which how we have to fix the animal. That all arrangement has also been shown. Like for that, okay, before this arrangement, it will come after two slides, that in what way we have to fix the animal so that we can really make any type of manipulation in the brain, and still animal will remain immobile and will not produce any trouble during the surgery. In order to have a cannulation, we require some stuff, the consumables, that are called the cannula assembly, because that we have to really implant over the skull of animal, and through which we can access the brain. It is divided into the three parts. One is called the guide cannula. This is the guide cannula. This is the dummy cannula, and another one part that is called the injection cannula. Using all these three components, we can very easily implant that guide cannula over the skull, and can make a fit dummy cannula. We can fix over it so that the patency of the cannula will really maintain, and whenever we have to do the injection, that time we can inject the internal cannula into the guide cannula. In order to understand this surgical part, which can really be demonstrated in the laboratory, but this is a webinar, and through which I have to communicate to you, so I'll make every possible effort in order to explain you in what way this surgery is being conducted, and it will be as good as like a demonstration for you, wherein now understand that we are taking one example, that we are selecting the animal, that is the adult male rat from any species, maybe like a Sprague Dowley, having the weight like 250 gram. For that, in order to have a intracerebroventricular implantation, now here we are doing the ICV surgery. This intracerebroventricular can be abbreviated as ICV, and for that these three coordinates we have been selected, referring this Paxinas and Watson atlas, and this is with reference to the bregma, that 0.3 mm posterior, 1.3 mm lateral any side, because we are targeting the lateral ventricles. They are present in both the hemispheres, lateral right, lateral left, so it can be plus or minus. And 3.5 mm ventral, deep we are reaching to the brain. At that area there will be a very prominent lateral ventricle is present. See, this is a picture of lateral ventricle. So when we are using these three coordinates, see, this is the entire brain. In that entire brain, this area is called the bregma. From bregma, how much posterior we are coming? We are coming only 0.3 mm posterior. Just look at the cursor, 0.3 mm posterior. At that level of the bregma, this picture of the brain is been there, and this is at this level. This line is indicating that this brain slice is obtained from this area. It's a bregma, and we are going the 0.3 mm posterior. So this is the part of brain. In that, laterally, just imagine this is a center, and laterally we have to go 1.5 mm lateral. You go to the right or the left side. At both the side we are having the prominent lateral ventricle, and yes, going 3.5 mm ventrally. Just see 1 mm, 2 mm, 3 mm and 3.5 here, 3.5. We are really there into this lateral ventricle. So by using these three coordinates, we can really reach to this part of the brain. Now, for that, first we have to anesthetize the animal. Animal should be fully anesthetized, deep anesthesia. Then only such central surgery can be performed. And for the anesthesia, if animal is not, very calm and if aggressive, then we require some pre-anesthetic medication to be given to the animal. And in the actual anesthesia, after 10 minutes, for the cannulation surgery, we require this halazine and ketamine at this particular doses, and by using this route of administration, we can very well have the deep anesthesia into the animal. If these chemicals are not available, because ketamine is been banned, which cannot be really buy unless we have the prescription from the veterinary surgeon. Otherwise, thiopentol is easily available in the pharmacy. For minor surgery or the short-term anesthesia, we use the inhalational anesthesia, and for that even the chloroform, diethyl ethyl, halothane or isopleurin, such gases can be used. See, this is the actual picture. So just have this look at this picture and you will understand that, okay, in this way we have to fix animal into the stereotaxic frame. So you know the stereotaxic frame, that is the U-shaped stereotaxic frame at the base, and there we have the provision. It is called the teeth bar, and this is the nose bar. This angular bar is a stainless steel nose bar, and this is a teeth bar. In teeth bar, we have seen the incisor bar, that are incision teeth at the upper jaw that is present to the animal, that we have to fix into this hole. In this hole it will be fixed, and then over the nostril we have to put this nose bar. Now these two ear bars, not exactly directly into the ear, but you will find that just at the level of ear there is a depression into the skull bone, and that depression we have to use in order to fix the ear bar into this area. So fix ear bar here, and then the incisor bar into the teeth bar, and we have to have the control over the upper side by fixing the nose bar. Now in this position, even if animal becomes reconscious and come from the again becomes the conscious, and somehow try to make the movement of the body, still it cannot move the skull area, because it has been fixed very well by using the different positions and the fixtures. Then we have to use the hair remover cream, apply over the skull area, and then by taking the cotton swab we have to gently remove the fur which is present over the skull. In the next stage, by using the scalpel or the razor blade, we have to give a very gentle or the kind incision over the skin, and since the skin is very thin, it should not damage to the skull area, rather it should only cut the skin area, and then you will see this picture, and this picture is nothing but the skull area of the animal, and in that skull area these two are these are the coronal sutures, this is the anterior suture, and this is the posterior suture. So very well lambda can be seen, and for that simply you will have to apply the cotton bulb which has been dipped into the rectified spirit or into the H2O2, and gently rub over the skin, so that all the connective tissues that are present over the skull bone, that can be removed, and then automatically we can see a very clear picture of this one. See, this is the original picture in which the all sutures are visible, even the lambdoidal sutures and posterior connected to the lambdoidal are being visible. Then we have to mark this point, that is the bregma point. Once we mark that bregma point through the needle we have to keep on the bregma point, and this is the probe, and that is attached to the the lateral axis on the stereotaxic frame, and through that lateral axis then we have to adjust, and that time all scales that are being given on the anterior posterior axis lateral right or left axis and dorsoventral axis we have to consider as a 0, and then accordingly we have to take the different coordinates like 0.3 mm posterior, 1.3 mm lateral and 3.5 mm ventral, and then we have to come to miss. First we have to consider only the two coordinates, and through that, see, this is a bregma point. From bregma, posterior 0.3 mm and lateral 1.5 mm, we are really come to this area. And at this particular area, by using the dentist drill having the burr size like 1 or 1 to 5 mm, we have to make a drill to the skull. See that when you are making the drill to the skull, it should not really penetrate into the brain. So skilled persons are required in order to drill this part, and once we have drilled to this area, then implant the guide cannula. Guide cannula is been implanted to that place, and along with the stylet, that is called the dummy cannula, and also the screws that are available into the watch Shopee, or even you can directly purchase it from the electronics market. These small mounting screws are available. For that also additional holes we need to drill surrounding to the main hole, and into that 3 such mounting screw need to be fixed. Next, when such screws are being fixed, we have to use the dental cement that is come along with the solvent, and then that dental cement we have to mix with the solvent. It becomes a jelly preparation. That jelly preparation, by using the scapula, we have to add over the skull and make a total area cemented, so that it will also take consideration of these mounting screws, and it will all over the surrounding to the guide cannula, and throughout the skull region we have to apply the cement. Cement hards immediately within 2 to 3 minutes, and before that we have to apply very properly over the skull, considering that yes, it will really engulf or will take into the mounting screw as well as the guide cannula. And this is what you will see the picture after having the cementation. Now for that, even we can have a in order to supply the drug constantly to the animal and make animal addict to that particular substance, we use the osmotic pump from the LZ, and this osmotic pump having the capacity of like only the 0.5 ml, and in that total capacity the osmotic pump directly been connected to the polyethylene tube, and this is the internal cannula. And here actually we use the morphine drug, and morphine is been dissolved into this solvent, and that has been added into this osmotic pump, and then it has been fixed. See, in this way we have created one pocket at the subcapsular region over the neck of animal, and this bullet like apparatus, it has been fixed into that one, and then the skin area is been sutured, and then this polyethylene tube along with this internal cannula, it is fixed over the guide cannula. This total area is been cemented, and now that assembly was there with the animal for 7 days, and during 7 days for 24 hours constantly 1 microgram of morphine for 1 minute was constantly supplied to the brain of animal, and that is how animal becomes addicted to the morphine, because it is a repeated and not exactly repeated, rather I am saying very constant supply being provided and directly into the brain. There is no kinetic parameter, so that drug will get metabolized or it will get distributed and get eliminated. It directly been injected into the brain, and that is for the total duration. Constantly drug was being delivered. Once we perform this surgery, okay, just ignore this part, the osmotic pump part. Just understand we have implanted the cannula, that is the guide cannula, over the skull of animal. All things are being cemented. Now how to take care of the animal once this surgery is been done. For that, we have to give rest to the animal for 1 week. It's a simple, because it's a central surgery, and that stress has to subside. For that, at least 7 days resting time should be given to the animal. Then we have to house animal singly, means animal need to be housed single animal into the cage not 2 or 3 animals, because there are chances that other animal will, fight with to that animal and may damage the the implanted things that are over the skull of animal. And we have to daily handle the animal, so that we have to remove the dummy cannula, again put the dummy cannula, grass the animal, hold the animal, and try to handle it, so that at the time of injection animal should not develop unspecific stress, and which will create error into the data. Then we have to inject the antibiotics, analgesics, and also the saline preparations to the animal. Now, in order to load the drug into the syringe, that is also the very crucial task need to be performed very skillfully, because the highest quantity or the maximum quantity that we introduce into the brain of animal is 5 microliter. It's a very small quantity, and that is only into the ventricle region. But if we have a cannulation into the brain area or the brain nuclei, there is no wide space, and into that 5 microliter may not be possible. So in that area or the brain nuclei, we use only 0.25 microliter. Such a small quantity we need to inject into the brain of animal. So that task has to be performed very much skillfully. For that, this surgery, the procedure that is been mentioned here, it is the loading of drug into the Hamilton syringe, which is having the capacity say 10 to 15 microliter. So using Hamilton syringe, it's a needle area, this is the polyethylene tube, and this is the injecting cannula or the internal cannula that has been introduced into the guide cannula. And by tapping the plunger, see this plunger, we have to tap and push the plunger such that it will take at least 5 minutes to deliver the drug into the animal. Very slowly we have to introduce that much quantity, not much quantity, 5 microliter into the brain of animal, so that there should not be a backflow, and very clearly drug can get introduced into the brain of animal. So through this picture we can see that how we have to grasp the animal, so that we should not have much pressure over the trachea or the esophageal area in this part or onto the neck region, but then drug should enter into the brain of animal. The one example that we have selected, and this is the picture of the lateral ventricle wherein we want to introduce the drug. By having this, we have many publications, because this is the this is God grace that Dr. Subedar sir, who is from the zoology department, he has done his PhD under PD Prasad Rao in zoology department, but then did his all service into the pharmacy department, and we are fortunate enough to work under him. He procured that stereotaxic apparatus in 1975 or 77, and from that time this surgery is been conducted in our lab. So it's like almost 40 years, more than 40 years, that surgery is being practiced into the lab. By using that stereotaxic cannulation, we have performed many such experiments, wherein we have given use the orexin, and through orexin, by this much quantity only, directly administer ICV into the animal, intracerebroventricular, and through which we could check the effect of orexin, which is a orexigenic peptide, on the food intake of animal. And we found that with the cumulative food intake at the different time points like 1, 2, 4 or 6 hours, there is an increase in food intake by the animal. Even what type of advantage this technique offers. This is the one example that I showed you. But what are the different? Hello, Archana ma'am. Kindly mute your mic. Hello, mute yourself, Archana ma'am. Yeah. So what are the advantages that are being offered by this technique? Technique is very simple, but the drugs which cannot cross the blood-brain barrier, and therefore when we administer them peripherally, it doesn't reach into the brain, and therefore we really deprive from the central effects of that molecule. So for that, stereotaxic is very must. Secondly, whenever we are administering the drugs peripherally, they also perform, or they also get distributed into the peripheral regions of the animal and do enter into the brain, but peripheral effect may be more, and which can bury the central effect. So automatically, because of non-specific effect, we are not having attention towards the central effect of the molecule. Secondly, we require very small quantity, because there is no pharmacokinetic. Drug is not getting absorbed, distribute or metabolized. Drug is directly there on the receptor site and acting. Therefore, we require very small quantity, very small dose, quick onset of action. Yeah, drug don't have to really perform any task to reach to that particular site where it has to perform the effect. So it is directly on-site administration is possible. Therefore, very quick onset of effect is all endogenous signaling or the ligand or the autocars, their effect can be nullified by using the stereotaxic technique. Now here we'll consider the another example. Excuse me. In this example, now we are targeting the brain area that is called the central nucleus of amygdala. See, this is the extra hypothalamic part. This is the hypothalamic part. It's extra hypothalamic, and wherein this is a central nucleus of amygdala. Now, in this surgery, we have to have cannula that will be implanted, see, all along this brain, and it will come into this part. By performing this particular cannulation, we check the interplay between the alpha melanocyte stimulating hormone and the neuropeptide Y. These two hormone plays a very great role in order
There are lots of disturbances during.
to anxiety into the emotional center of the brain, that is called the amygdala, and that too into the central nucleus of amygdala. In the really understand the different parts of the brain and am I audible? Am I audible now? Now am I audible?
Yes, sir. Yes, sir.
Hello?
Yes, sir, you're audible. In between, the voice is quite breaking,
Yeah.
or now it is correct.
So in the electrophysiological studies, okay. No, I'm taking enough care so that I'm like very close to the mic and try to deliver the seminar. See, in the electrophysiological studies, there are the three approaches through which we can really understand that how much electric current is being generated into the different parts of the brain, or we can intentionally supply the electric current, and also by giving the maximum current we can produce the lesion to the brain. In the one project, we could procure the operant chamber, and by using the operant chamber, we actually had the implantation of electrode on the skull of rat, and then rat is being trained into the Skinner box, wherein animal has to press the lever, and once it press the lever, then microampere current get delivered into the brain of animal, in which area that area will be producing the rewarding to the animal or punishment to the animal. If it is a punishment area like it's a ventromedial hypothalamus, then in that area animal doesn't touch to the liver because it don't want the punish. But when it is been there into the nucleus accumbens, then in that area animal really loves to have a more pressing of the liver because it feels rewarding, euphoric and well-being. So conducting this experiment with the our collaborator, even the Subedar sir and the Amul Sakarkar sir in the Pune units, we have seen that the liver pressing, how it has been increased, and for that we conduct the experiment into the CART, that is the cocaine and amphetamine regulated transcript peptide, and that peptide is being delivered into the lateral hypothalamus, and through which we understood that okay, in what way this lateral hypothalamus medial forebrain bundle, which is a dopaminergic pathway, and targeting the electrode to that area, and then animal was pressing the liver like anything, and that reading is going up to that animal performs the pressing in half an hour up to 1500 to 1600 liver pressings. So that is the the beauty of this surgery, that when electrode is the right area of the brain, and in that right area if there is a pressing, then current will get delivered, it will activate the neuronal system, and there is a too much neurotransmission of the dopamine takes place into the nucleus accumbens, and that is how we can see the more liver pressing by the animals. In the Skinner box, or that is also called the operant conditioning, we have the another mode through which instead of delivering the current, we can have a delivery of 100 nanoliters, such a small quantity for each liver press into the brain of animal. And for this we had the one experiment in which the alcohol was being self-administered into the area of the brain of animal, and through which we check that if alcohol is there into that region, it activates the GABAergic system, through which dopaminergic neurotransmission, and there can be increased turnover of dopamine or neurotransmission into the nucleus accumbens. So by using that technique, that is the how we can directly have the ethanol self administration into the ventral tegmental area, through which we understood the mechanism of melanocortin 4 receptor into the nucleus accumbens area. And for that we have seen that that area is being supplied through the neurons which are originate from the arcuate nucleus, or the seen into the brain nucleus lateral side. And see, this is the way through which this much milligram of ethanol is being administered at this different time point. And then we have seen the liver pressing by the animal, and when there is no ethanol or only the artificial CSA,
So your voice is breaking.
and the antagonist. But if all that modulators are not available, then even by using the antibodies for that particular neurotransmitter or the neuropeptide, by introducing that antibody will bind to that particular ligand, and it will neutralize that ligand, and ligands are not available to act on the receptor, and that is how we are antagonizing the effect of that particular endogenous system, and through which what effects is being affected, that can be read or manifest by the behavior of animal. And simply by checking the different parameters in the behavior, we can very well understand that for what activity this particular neurotransmitter is being responsible. So by using this particular approach, that is the central passive immunoneutralization, not having much consumables, but still we can understand the function of endogenous ligands. In order to explain you the suitability of the stereotaxic methods, yes, if there is much financial constraints, yeah, there is also the Indian make are available for the stereotaxic apparatus, and within 1 or 2 lakh we can really have a fabrication of this particular frame. In this we are having a very good solution for the neuroscience like condition, and in which we have to require only small stuff like the apparatus, then there are drillers, dentist drill, and the dentist cement and the solution, and some syringes or the fine chemicals, and of course animal. Now this is the another side of this surgery, in which I want to explain you that performing surgery, having the administration and read the behavior from the animal, that is the one part, but to check the placement of the cannula at the right, whether it is at the right region, that is also the very critical task, and that need to be performed. Then only we can underscore that whatever behavior that has been performed by the animal, it is only because of that into this particular area. So there are 3 different modes through which we can really check the placement verification of the guide cannula. One is that we have to administer very established molecules and which is known for its effect. Like if we administer neuropeptide Y, which is known for its orexigenic effect, and then which will, if it is the cannula, if it at the right place, then that NPY will act on the NPY receptor and will produce the orexigenic effect, and through which increase in food intake, if it can be seen in the animal, then we can say that cannula is at the right place. Secondly, after having all the experiments, we have to kill the animal, sacrifice the animal, isolate the brain, and through simple razor we have to cut the brain and go to the level of lateral ventricle and check whether diluted India ink which has been administered before sacrificing the animal can be seen into that lateral ventricle. If at all present there into the total ventricular area, then we can very well endorse that this particular injection was being done into the ICV. And next, that is the third mode that can be opt only for the intranuclei injection, in which if we are doing the cannulation into the any particular nuclei of the brain, for that we have to isolate the brain and then take the slice of that brain area, stain with the crystal violet or the hemotoxin, and then check that yes, that particular area along with the atlas, that this is the amygdala, this is the hypothalamus, and then cross verify it and confirm the placement of the guide cannula which is been implanted. In one such experiment, reviewer has asked us that okay, you provide the histological pictures wherein you show that your guide cannula was there into the lateral ventricle, and therefore we did the exercise, and in that exercise crystal violet stain histological section you can see in front of you in this slide. This is the area through which it is called the passage area, through which the that guide cannula was introduced into the brain of animal, and this is the corpus callosum. It has also been gone beyond that, and see, this is the lateral ventricle. Is very wide space available into the brain where little error is possible because that area is very large, lateral ventricle. And yes, we could show them that drug was introduced into the lateral ventricle. On similar side, we have also shown that yes, drug was administered into the central nucleus of amygdala, which is a very core region into the brain at the ventral side of the brain. But yes, this is the way through which guide cannula was introduced into the brain of animal, and it was at the area of not only in the amygdala but that too in the central nucleus of amygdala. And they have also asked us that when you introduce the 0.5 or 0.25 microliter of quantity into the CEA, how far it get really diffused into the surrounding region. So for that, dilute India ink is been introduced into the right quantity, and we showed them that yes, it is only within the CA and not really get diffused into the surrounding region. So there is no non-specific effect is been associated with this injection, and only specificity or the effect of only within the central nucleus of amygdala can be understood. This is the bilateral cannulation that has been done into the one such area that is called the paraventricular nucleus, and into the paraventricular nucleus two cannulas were introduced, and they are very adjacent to each other, but somehow we can really manage because in both the hemisphere it has been introduced. And this is the passage of the guide cannula, and see, this is a crystal violet stain slide in which you can find this is the aggregation of the neurons that are there only into the PVN, and this is right above the PVN and not damaging the PVN. So if injections are being made here, it will get diffused into the PVN area and not going in the other parts of the brain, and effect whatever effect is being produced, that we can really attribute only to the PVN. Here you will find the another application of the stereotaxic technique, and in that application we use the retrograde tracing, and that retrograde tracing is being used in order to track the neuronal circuitry within the brain. And in order to track that neuronal circuitry, we have to have the injection of that tracer. Say here we use the II tracer. II is a retrograde tracer, and which has been injected into calculus, which has been injected into the area that is the nucleus calculus, and then after 14 days, that dye retrogradely from axons towards the cell, it has been traveled and then come to the nuclei wherever it is having the access, and then we could show that the neurons from the arcuate nucleus or from the lateral hypothalamus. They are directly communicating to the accumbens cell, nucleus accumbens cell, and they have been co-labeled with the CART, and this is a fluorescent immunohistochemistry, and by using this fluorescent technique, this dye is also been co-labeled with the CART. And yes, these are not the any neuron which has been originating from the arcuate nucleus and then get led into the nucleus accumbens, but these neurons are the CART containing one, and they are originating from the arcuate nucleus and terminate into the nucleus accumbens cell. This is like I told you, this stereotaxic technique is been practiced in our lab from last 40 years, and into these techniques, the Subedar, under the mentorship of Subedar sir, we come up with some tools which are like very much costly and we cannot really afford in order to conduct the stereotaxic cannulation, and that is the cannula assembly. That cannula assembly like more than 1,000 rupees if we need to procure it from 1,000 rupees if we need to procure it from the out. We need to procure it from the out. It requires 1,000 rupees. Not a very wise. The cost of the cannula system that we developed, fabricated in our lab, which is only 2 to 3 rupees, compared to relatively to the 1,000 rupees if we procure it from the outside. And this is only by needle, one needle, and the needle has to be cut appropriately, and all these dimensions are given here. You can refer this paper also. It is published in 2011, in which the total procedure that has been mentioned, that in what way we can fabricate the cannula system for the intracranial injections. And see, this is the guide cannula, this is the stylet, and through which we can have a implantation of this guide cannula over the skull, and through stylet we can maintain the pattern. This is the bilateral. See, here is a bilateral, here is a unilateral. By using the insulin syringe, just imagine insulin syringe, we can develop the injection cannula, and that injection cannula which is having the gauge size like 33, and that 33 gauge size is like a very minimum which can really introduce into the guide cannula, which has been prepared from 24 gauge needle. And then by using this polyethylene tube and the internal cannula, we can make direct injection into the brain by using, or by it, how much it costs? It costs only 2 to 3 rupees. Another protocol that we have been established in the lab, that we can also fabricate the electrodes. Electrodes is again more costlier item, and by using that electrodes, ready-made electrodes, we can have only 4 to 5 animals, but when you have to use animals in hundreds, you cannot use that that consumables, because they are too much costly. So we also develop the one method in order to fabricate the electrode system within the lab, and that cost only 100 rupees. This electrode like 2 to 3,000, but we fabricate in the lab, and that is only in 50 to 100 rupees. It's a very simple and economical method through which the bipolar electrode system can be developed, and in this way it can be really implanted over the skull of animal, and then it is in a stereotaxic it is in the operant conditioning, and through which we can directly make access or stimulate the desired brain area. The entire procedure, the complete procedure, right from the taking the electrode wire and then how we have to fabricate, it is mentioned in that paper. This has been patented, and yeah, now few slides, only 3-4 slides are remaining. This is one such experiment that has been conducted by using the application of stereotaxic technique. We have developed the dual assembly, that is the dual electrode cannula assembly, in which the assembly is being fabricated such that we have the bipolar electrode, along with it there is a guide cannula. They have been assembled together, so simultaneously one particular nuclei we can really stimulate by having a electric current, and also we can deliver the chemical or the drug into that area. So when they are in a combination, there can be a synergistic or antagonizing effect and can be checked by having only one implantation wherein dual electrode cannula assembly is being fabricated. And this work is being published in the Progress in Neurobiology, in which LSD1 BDNF activity is being checked into the lateral hypothalamus for the reward seeking behavior. In that animal, we have also been taken the slices of the brain and did the Golgi staining. And with Golgi staining, we can really see the the total axonal and the protrusion or the spines that are developed on the or the arborization that is there into the axonal area of the one such cell. See, this is the one cell, and radially there is the axons can be seen here, which are been more built or been much developed into the area of the animal which has been conditioned to the intracranial self-stimulation. This is the ICSS. These are the different applications of the stereotaxic techniques through which we can have a cell delivery, that is the stem cell delivery, or even the viral vector can be delivered into the brain area. This second technique, this has also been standardized in our lab, through which we can really implant the microdialysis probe into the brain, and we can obtain the diastylate, and by using that diastylate we can process that diastylate, dilute further and inject into the HPLC through the electrochemical detector, and we can really understand the level of different neurotransmitters or the monoamines into the that region of the brain. Even using this technique, we can do the spinal cord injury and spinal cord grafting. Stereotaxic also been done even into the human subject. When MRI is been MRI scanning is been conducted to the human subject, when that subject is been been taken inside into that particular scanning, there is a stereotaxic frame available, that is a human brain atlas, and by using human brain atlas we can really have a different orientation of the human brain, and that is how we can take a different scanning images of the human brain. Also, radio surgery can be performed by these techniques. Thank you everybody, and I really sorry and regret that there was trouble at the beginning because the some network connectivity issue into the our lab, but this is only because of Nitin Dongarwar sir. He could make available his entire system for me, and I could really deliver this talk for you. Thank you everybody.
Thank you so much, sir, for such a nice lecture.
So even we can entertain the queries if delegates have some queries over this stereotaxic surgery.
Friends, if you have any
Sir, I have a
question, you can
query.
ask. Yes, please.
Sir, I have a query. Sir, after the
Yes.
sacrifice of the brains, how is it preserved?
Yeah. Once you sacrifice the animal, during sacrification only, we have to use the transcardial perfusion procedure. And by using that procedure, first we have to perfuse the animal with phosphate buffered saline, and then immediately in the next syringe there should be a fixative like formaldehyde
Yes.
or
Yes.
4% paraformaldehyde that we need to introduce into the body of animal, so that animal becomes totally fixed, all tissues or the total animal becomes very much stiff, fixed, and then we have to decapitate and isolate the skull, and then take out the brain, and then go for the appropriate region for the slice, so that you can see the right placement of the guide cannula.
Okay, sir. Yeah. Thank you.
Excuse me, sir.
Yeah.
Sir, can we
Hello.
apply this
Yeah.
method in other animals just like birds also? Same method?
Birds. Yeah.
Yes.
You mean to say in birds?
Yes, yes, yes.
Yes, ma'am. Actually, no, I don't know now from which subject or background you, but then there is a lab in
I'm
Lucknow
zoologist, sir.
University
I'm
and also
zoologist.
in Delhi University in zoology department. There is
Yes,
a
yes. I'm
Vinod Kumar
zoologist.
sir and Dr. Sangeeta Rani. They are doing the stereotaxic cannulation in the birds, but for
Okay.
that they are not having available with the stereotaxic atlas for that particular bird. But if you have a, if you develop or if you understand the total neuroanatomy of that bird, then at least you can know that not exactly into the ventricle, but at least you can do the intracranial injection into the brain, intracranial injections, and that is possible. Many people are doing the intracranial injection in birds also.
Okay. Nice
Hello.
session. Thank you, sir.
Yeah,
A nice
even
session.
the
It's nice session. Thank you, sir.
Praful Singru sir in Nicer, Bhubaneswar, he's conducting the stereotaxic cannulation in the birds.
Okay. He is our ex-dean. Now he
Yeah,
is working in
right.
Ramtek ex-principal.
No,
Or
no,
he maybe.
that Singru sir, no, that is Rajesh Singru sir in Ramtek. Rajesh
Okay.
Singru sir. Yeah, he's from chemistry. I am saying Praful Singru sir. I think they are brother only, no, distant. He's working in Nicer, Bhubaneswar. Praful Singru sir.
Okay. Okay.
Yeah, yeah, he's from
Thank you, sir.
zoology. Yeah,
Yeah.
thank you, ma'am.
Thank
Any question? ओके सर काही क्वेश्चन्स नाही आहेत.
Okay, thank you,
Okay.
Preeti ma'am.
Sir, thank you on behalf of UGC HRDC Nagpur and from all the participants. I extend my thanks to you, sir, for your wonderful session and experimental work was very nice, sir. Thank you so much. Thank you all of you. Now you can proceed for your lunch break. Our next session will start at 1:30.
Hello, Preeti ma'am.
Yes.
हाँ, hello.
हाँ बोलिए.
After uploading the
Madam,
after uploading
Ma'am, still your voice is echoing, ma'am.
how to ask should I ask in this WhatsApp group?
Ma'am, you can call me personally, no issues.
Okay, madam.
Okay.
It's not a very big thing, but still I wanted to ask you.
Yes, yes, no problem. You can call me because it is echoing.
असंच म्हणजे intact राहिलं.